Hey everyone, welcome back to the Vital Signs Vlog, your essential resource for teen health tips, sexually transmitted infections awareness, and safe sex practices. Today, we're emphasizing the critical importance of regular STI testing for sexually active teenagers, especially if you're among the 30% of high school students who have had sex, according to the Youth Risk Behavior Survey. More importantly, practicing safe sex reduces infection risks dramatically. These recommendations come from Reilly Allmoslecher, Clinic Director at American Family Care Urgent Care Joplin, who urges teens and college students to get confidential STI testing at least once a year. AFC is an ideal place to get these tests done. Let's dive into what parents and teens need to know about sexually transmitted infections to stay safe and healthy. Sexually transmitted infections, or STIs, are incredibly common, caused by bacteria, viruses, or microorganisms spread through all kinds of sex. Most are treatable, but untreated STIs can lead to fertility issues, pregnancy complications, lifelong infections, or serious health problems. That's why STI awareness and prevention are key for teen sexual health. Let's break down some common STIs, their causes, symptoms, and treatments. Knowledge is power. Chlamydia, the most reported bacterial STI in the U.S., often shows no symptoms but can cause vaginal or penile discharge, painful urination, or rare testicular swelling. It's diagnosed by urine test or swab and curable with antibiotics, but untreated chlamydia risks infertility, especially in women. Gonorrhea, another bacterial STI, mirrors chlamydia symptoms and can also lead to infertility in both sexes. It's treatable, though some strains resist standard antibiotics, requiring extra testing. Trichomoniasis from a protozoa may cause itch, irritation, and discharge, or nothing at all. It's curable with medication. Syphilis is rising. Early stages feature painless sores, then rashes, fever, sore throat, fatigue, swollen nodes, or weight loss. Untreated, it can damage organs like the brain and is dangerous in pregnancy. Antibiotics cure it, but late damage may be permanent. HSV, or herpes simplex virus, causes blistering sores, oral HSV1, or genital HSV2. It recurs lifelong with no cure, but medications manage outbreaks. HSV risks are high during pregnancy, managed with prenatal care. HPV, the most common STI, spreads via skin contact and is usually asymptomatic. Most clear naturally, but persistent HPV causes genital warts or cancers. The HPV vaccine, starting at age 9, prevents it effectively. HIV affects those with other STIs due to risky behaviors. Early flu-like symptoms fade into asymptomatic periods. No cure, but medications control HIV and prevent transmission, vital for long-term health. This sounds serious, but teens can prevent STIs and minimize complications easily. Use condoms every time, properly, to reduce transmission. Limit sexual partners and have honest talks about sexual history and testing before sex. Get tested regularly. Reilly Allmoslecher recommends annual gonorrhea and chlamydia testing for sexually active teens, or more if needed, plus other STI screenings. Shockingly, 95% of high schoolers haven't been tested in the past year, per the Youth Risk Behavior Survey. See your doctor regularly, or you can always come into AFC Urgent Care Joplin and be honest for confidential advice. Parents, give teens private time with doctors to encourage openness. For peace of mind, visit American Family Care Urgent Care Joplin for confidential STI testing. Reilly Allmoslecher and her team are here to help without judgment. Parents, talk to your teens about STI prevention. It's not condoning sex, it's protecting health. Teens, prioritize safe sex practices and regular STI testing to enjoy a healthy future. If this vlog empowered you on sexually transmitted infections, teen sexual health, or safe sex education, like and subscribe and comment. What's one STI prevention tip you'll share? Stay safe and informed. See you next time on the Vital Signs vlog. If you are feeling under the weather, you can walk into American Family Care Joplin 7 days a week with no appointment to get a diagnosis. We will have you feeling better and back on your feet fast. AFC Urgent Care Joplin, located off 3rd and Range Line behind Starbucks. American Family Care, the right care, right now.